Ladies and gentlemen, it's often said, follow your heart. Sometimes we do, at times we are not able to. And more often than not, when we don't follow our heart, we aren't as happy as we perhaps could have been. Matters of the heart are important, and when it comes to heart health, it becomes all the more essential for all of us to listen to our heart. 29th September is observed as World Heart Day, and here's an info that perhaps you would not like, but I have to give it to you because it's important. India is called the heart disease capital of the world. A country with the largest population of youngsters has been witnessing a rise in cardiac arrests. 25% of all heart attacks are in people below the age of 40 years. Among them, 25% Indian men suffer heart disease. Women too suffer high mortality rates due to heart problems. Heart attacks, remember, strike Indians 33% more than others around the world and quicker. But look at the irony. We've become more aware of being fit. A lot of us head to the gym every day. We maintain a healthy home-cooked food diet daily. And yet, many are still collapsing suddenly while working out, dancing, or just plain walking. And the videos are for everybody to see on social media. Let's understand why this problem occurs and how we can tackle it in the times that we live in and the kind of lifestyles we carry with ourselves. I'm first joined by senior cardiothoracic surgeon and chairperson of Medanta Hospitals, Dr Naresh Trehan, on the broadcast. Let's talk to him and understand more about heart health. Dr. Trehan, good evening. Welcome to Beyond the Headline, and appreciate you talking with us on Mirror Now. First of all, help us understand, a lot of us are getting more and more aware of being fit. We exercise, we have our diets and, our salads and our vegetables in place. Yet, why are so many young people suffering cardiac arrests and heart attacks?
See, there are two facts that must be known. One, as India is known as the heart disease capital of the world, the other thing is that in addition to that, we get heart disease 10 years earlier than the Western population. So this is worrisome to all of us. And we have been working on it for a long time, trying to figure out why the disease is so frequent in India and why is it occurring at an early age. A lot of factors contribute to it. And one of the things that we have actually concluded is that our lifestyle is very different from the Western lifestyle, and also our genetic propensity, our genes are more prone to heart disease. So how do we combat that? That we have been trying to actually educate people in what are the components of heart disease, like high cholesterol, fatty food, junk food, tobacco, lack of physical activity, stress. All these things we have stressed again and again. But in spite of all that, what we have actually been communicating to people, only 5 to 10% of the people actually have adopted a healthy lifestyle. The rest of the population continues to live the way they were living before. They don't care. They still want to eat everything that they can find. And it's not very healthy because the physical activity in our life today is totally gone, because everything is either you go by car or a motorcycle or ride a bus or a train. We don't, that natural thing of having to walk all day has gone. So if that be so, and our diets have become very rich, the mismatch has led to a lot of diseases, including diabetes and heart disease. So what do we do about it today? The first thing that we are doing today is, and Medanta is totally working on it and committed, is what we call predictive personalized health. So we are saying that we know that there are certain factors which make it more risky for some parts of the population so that they should know. So today we say, one, know your genes. If you have heart disease in your family, then the children will have double the risk of developing heart disease. If you have the risk factors already, you are smoking, you have a high cholesterol, you have a sedentary lifestyle, and you also have your family history of a genetic history, then those are the people who get more frequently heart attacks between the age of 30 and 45.
Okay. Dr. Trehan, there were also concerns post-COVID that the after effects of the coronavirus and the COVID disease have weakened the immune system and affected the heart health. Does it still prevail, and how long will it prevail? Will we still continue to see the ripple effects of COVID on our heart health?
So COVID has, depending on severity and frequency with which somebody has had COVID, you can be suffering from long COVID. Now, long COVID has many effects, and those effects can be over a long period of time. But most importantly, as far as risk to your life is concerned, a cardiac, if somebody is suffering from long COVID or has had severe COVID, they should get an echocardiography and a MRI, cardiac MRI done, which actually tells us very clearly if you have inflammation into the muscles of the heart. And those people who have inflammation should not go back to vigorous exercising till that inflammation has subsided. So we can give you medicines to control it. We can actually make a program for you when to start. So, but the fact is that especially if you are into excessive exercising like running or like bicycling vigorously or dancing vigorously, all those things require the heartbeat to go up. And when the heartbeat goes up, you can get irregular heartbeats, which makes you collapse. So those people who are vulnerable, according to what I just said about severe COVID or multiple times having COVID or long COVID, they should be checked before they are allowed to go with the vigorous exercise. That will help.
All right. Dr. Naresh Trehan, thank you very much for joining us on the broadcast tonight on Mirror Now and helping us understand heart health better. Thank you very much. Let me also now go across to my other guests on the show. I'm joined by Dr. Gautam Jugal, senior cardiologist. Vesna Jacob, physiotherapist and holistic fitness expert, joins us. I'm also joined by Dr. Puru Tyagi, who's a health expert. Good evening and welcome to all of you. I'll start with Dr. Jugal first. Dr. Jugal, we just heard Dr. Trehan talk about how, the young are falling prey to heart problems suddenly, and this really, can date back to their genetic makeup and, the kind of lifestyle they carry on. But before getting into the details of that, help us first understand what's the difference between heart attack and cardiac arrest, two terms which are used very interchangeably, but I believe medically they're very different terms.
Yes, heart attack is wherever there is a blockage in the coronary arteries, we supply blood to the heart. So in this condition, patients get some of the symptoms like, heaviness in the chest burning. Sometimes there would be sweating, left arm pain, and these kind of symptoms would be there. And on the ECG and other investigation, this is reflected that this could be a heart attack. In cardiac arrest, the circulatory system from where this heart blood is pumped to the other organs of the body, especially to the brains and other parts, is stopped. So it's a standstill, you can say. And when we label it as a cardiac arrest. So this is the basic difference between the two. Cardiac arrest is an absolute emergency where we require immediate medical attention There are like things like immediate CPR would be needed, and generally to restores like whatever heart's normal rhythm. And sometimes we have to rush patients to the very immediate to the medical facility.
Okay, Vesna, let me come to you. You're a holistic fitness expert, and you've been dealing with a lot of young people, young adults. I'm sure come to you for changes in their daily routine and for working out. Have you ever had people come to you regarding heart health? Do you have people who suffer from heart problems, and how do you then go about it?
Well, of course. I mean, we are working with young as well as not so young individuals, and everybody has a different potential medical history. So, the rule of the thumb is that if we know there is a pre existing cardiac issue, whichever nature it is, it means a very gentle introduction to exercises. It means that we are monitoring heart rate throughout the exercise, either through the monitor or through the strap. So that would be number two. We are starting and we are progressing very gently. And if there is any difficulty with the breathing, that would be one of the red flags. Having said that, even if you do not know that you do have any heart issues, you still, when you are starting with any sort of exercising routine, you should always start very easily, very gently, and then progress gradually. In addition to that, we need to monitor what is the hydration levels, what is the quality of sleep, and what is the stress level, because all of these things absolutely affect the well-being and potentially can play the role in the heart health. Having said that, anything can be dealt with.
Yeah.
So even if somebody does have a cardiac issue, with a gentle approach, with a persistent, with a change of diet, with meditation, meditative techniques, and a holistic approach to health, it can still have a great quality of life and be able to do majority of things like healthier individuals.
Dr. Purutyagi, Vesna mentioned an important point, that of stress. We don't really realize the kind of daily stresses that we all go through and perhaps ignore them and don't pay much attention to them. But they also have a large contribution to our heart health,
In fact, I would like to point out, as the speakers before me have already elaborated, that the two major risk factors are diet and stress. Now, as you very interestingly said, that a lot of people have homemade meals and yet they end up with heart attack. So, how does this anomaly happen? And this happens because the homemade meals that we have today are very different from the homemade meals that we used to have 2 or 3 generations back. Our food has gone up in salt intake, our food has gone up in sugar intake, and it has basically gone down in fiber intake. And not only heart diseases, but actually
Yeah,
this
in
kind
fact,
of
there's a
diet.
recent report that suggests that Indians are having 8 grams of salt more than actually the prescribed 5 grams.
Actually, 8 grams is, yeah, I mean, I would say that that's an average. We know about some people who like to have chutneys and achars with their roti. So all of that is concentrated salt. And on top of that, may I suggest that actually not only heart attacks, but this kind of diet which is rich in salt, which is rich in simple carbohydrates, this can also lead to an increased risk of diabetes, which is the mother of all the modern diseases. Because if you have diabetes, then you will end up having heart attack, you will end up having kidney failure, you might end up having stroke, which is a sort of a brain attack. And you might also have an increased risk of cancer with the diet that we are presently on. So over to you.
Okay, okay. Interesting points there, that of diabetes and such other external, factors also contributing to our heart health. Dr. Jugal, to you, we are just now, transitioning into the winter season. And one of the key concerns in this season, of course, is the air pollution that comes with it, the smog that comes with it. And a lot of people also have breathing issues. but that also contributes to our heart health, particularly in small children. And unfortunately, over the past few years, we've also seen school children suffering from cardiac arrest. Why is that?
See, heart and lungs are interdependent. Because finally, heart's blood goes into the lungs where it gets oxygen and then recirculate back to the heart. So these two organs cannot be separated from each other. And so whatever these pollution and other factors affect the lungs also affect indirectly to the heart also. This is one thing. And second thing, as everyone till now mentioned about the uh, increased population, young population suffering from the heart disease. The main things is that because in the added stress which are they getting, and the defective coping mechanism which these all young patients of heart patients are like having, junk food diet, and the most importantly in last couple of years there is a pandemic of heart patients, in particular in the young patients, because of maybe there is a element of COVID, the inflammation which that COVID has caused in the lungs. Along with that, it has caused that inflammation somewhere down in the heart's blood vessels also, and also in the heart's muscles also. So youngest patient till now I witnessed was 19-year-old. 20, 22, 23 is not unknown at all. Many of them we are like daily we are seeing 22, 23-year-old patients coming with the heart issues. And I think the whatever has changed in last 2-3 years, apart from the stress and all these things, is the COVID. And the other things like COVID vaccination, though we cannot directly like point out the things, but still there is an element of doubt that it has somewhere down the line had changed immunity in such a way that because till now in last 10 years, 12 years, we have never seen so many young patients. Earlier, whenever such patients used to come, we used to think only of smoking and tobacco. But nowadays, there are people who are non-smokers also, properly gym goers also, are following healthy diet also. And despite of that, they are getting heart attack, which is the most concerning thing. That means there is something which we
Dr.
are not
Jugal,
able to find
and
it out.
what's the gender segregation? Which of the genders is suffering from more heart problem?
Yeah, it's still same. Males are at more risk. As like for like ages we have seen earlier also, now also. Somehow they are, genetically,
and that's
women
attributed
are
to the
more protected.
genetic makeup?
Yeah, maybe their hormones, they somewhere down the line, they are safeguard for the females. So till 40s, before menopause, still women are having less heart issues. Even in now also, when we are seeing so many young patients, 23, 24, 28, females are very less as compared to males. 90% of the time we see male patients, young male patients, do they come with the heart issues, but females, fortunately, genetically, their genetic makeup is like that, or hormonal thing is like that. They are, they are level of less heart issue as compared to the males. After menopause, yes, again the ratio would be like comparable, but before menopause, still women are actually protected.
Vesna, what's been your experience? Do you have more women coming in and talking to you about heart health? Are people even aware of the fact that, when they're doing yoga, when they're doing meditation, there is one part of their body which is being ignored, which is the heart health?
Well, that's an interesting thing because before I came to India, actually, I thought people here, everybody was Zen, everybody is walking in the state of nirvana. And then I came here particularly to North India and then realizing that that is not much so. And there is definitely more awareness now when it comes to health overall. Having said that, there is still not a clear correlation that we need to protect heart and why and who should be. Usually people think that if somebody is skinny looking, that means healthy. And if somebody is not, which is not correct. The thing is, I think now there is a lot of fear, and the lack of knowledge, I feel, is one of the biggest issues, because I think preventive health should be taught as early as in schools. I feel that our schools and education system here are lacking awareness on the health, the proper diet, importance of exercising in the school, because we all want our children, of course, to succeed academically. But then the other side, if their health is not on par, then their academical skills are not going to be of much use if they start getting sick that early on. And then, of course, the importance of meditation, of stress, of de-stressing the body, and also getting off the electronic devices, having that proper sleep culture, because I feel there is a huge disparity that we are always switched on. Children are always switched on, whether that is TV, that's the news, that is Instagram, social media. And there is not enough time to introspect, to de-stress, to ground, to meditate. I mean, we are having the entire yoga available to us, which we can tap into. We have entire Ayurvedic system, which we can tap into, apart from the most modern medical and allopathic system that we have. And yet somehow on that ground
so the
level,
amalgamation of the traditional and the modern is needed.
Absolutely.
If we've to maintain a healthy heart health, we need that marriage between the traditional and the modern. I'm afraid I have a paucity of time. I'll have to wrap this up right now. But of course, one important focus remains the fact that we all have to focus on our heart health and not ignore it. We tend to ignore it at times, focusing on other parts of the body. But this is where the aim should lie. Thank you very much to all my panelists, Vesna, Jacob, Purutyagi, and Dr. Jugal. Thank you very much for joining us tonight and sharing your thoughts on a good, happy heart day. Thank you very much. Well, with that, we are slipping into a short break. News and updates will continue on Beyond the Headlines. Stay tuned to Mirror Now.